Well, Xi Chen joins me now from New Haven, Connecticut. He is an associate professor of health policy and economics at Yale University. Welcome back to the show.
Thanks for having me.
Oh, you're welcome. So, officials now saying the Chinese population has peaked and will begin declining earlier than predicted, Xi Chen. I want to start with why. What are some of the big factors driving this?
So the decline in fertility rate is a global phenomenon, and most of the countries are faced with this issue, and China is no exception. But what distinguishes China is that China implemented a family planning policy back in 1970s, and in 1980s one-child policy. But even before 1980s, the fertility rate already declined from 6 live births per woman to 1.6 at around like 2017, and even as low as 1.3 per woman in 2020. There might be an increase later on because of the after the pandemic, but the trend is continuing, the slowing down, the reduced fertility rate. I think the main reason is the burden of raising a child, having a child. So, and the society is not ready yet to have a more fertility-friendly environment to encourage more births.
I'm glad you brought up the one-child policy because that was relaxed back in 2016 into the two-child policy, which is now turned into a three-child policy. When do you think we might start to see the results of that? Might that help reverse the declines?
Right. In my view, there are 3 things that deter or hinder people from having more kids. The first is heavy economic burden, as I was mentioning, the housing price and the education price. So I think in that term, to relieve the economic burden, the government may need to implement more affordable housing policy, including rental housing or ownership of the houses, and also to extend the compulsory education to cover high school, more years of school, and promote the quality of education. So that will address the economic concern. And the next is address the concern of females to which may do harm to their career if they have more kids. So I think there should be more consideration about fertility subsidies, extension of maternal leave policy, promoting more gender equity at home and family-friendly workplace. All those policies have been implemented in some countries and achieved some success. But if a combination of such policy can be considered, so the effectiveness may be even higher. The last one is a lack of child care. So far in China, there's a lack of provision of nursery care, especially for those below age 3. So introducing more social capital into the society to build more affordable care facilities might be helpful. For example, the government can have some tax deduction for expenses on children below age 3 to encourage more such provision and supply and the demand of these services.
So, Professor, we've covered the why this is happening and also ways we can address to perhaps change the trend. But what are the implications then of this declining birth rate if it does not get reversed? What are its effects on both the economy and society?
Right. I think there's 3 folds. One is the economy. There's a large economic evidence showing that the aging society with fewer births will generate less investment because the older persons may consume less. And also the aging society may lack of innovation, and we know innovation is the engine of economic growth. And from the society perspective, although it's not immediate, but after 20 years with a lower birth rate, fewer young people will come into the labor market. That means that they will have a less support of the older persons who are just about to retire. So the pension system, the retirement system has to be adapted, but it will take time. And also in terms of family care, that also will be challenged because of fewer children taking care of parents. There needs to be care innovations, for example, telehealth, to manage the chronic conditions, which is the driving force of all kinds of diseases so far. And also maybe there need to be some innovations of like artificial intelligence robots to take care of the older adults. But we know that all these solutions may not be perfect, because in order to take care of the older persons, they really care about the face-to-face communications instead of dealing with robots.
Right, very fascinating indeed. Xi Chen is Associate Professor of Health Policy and Economics at Yale University. Thanks very much.
Thank you.